So smoking status. This is where we're going to be talking about the smoking status. This is something that you guys can do right now in 9.4. It comes default in the demographics. There might be a little bit of a change that you need to put in there so that it can fit it, but I'll show you how you can set that up in the list dialog. So what you have to do is record smoking status for patients that are 13 years or older. These are the statuses that they are looking for in the smoking status. So these are different than what come default with the system. Once again, if you upgrade to 9.5 or if you're a new customer, you'll get this automatically. If you want to do it right now, just so that you get that data in your system, I'll show you guys how to do that. So current everyday smoker, current some day smoker, former smoker, never smoker, smoker, current status unknown, and unknown if ever smoked. So those are the 5 statuses. Right now it comes with 3. So you guys will be able to see that. So if you guys are not aware of how to pull that, to change those statuses, I'll show you right now. So if we go to maintenance, templates, and list maintenance, you'll be able to look at all of the drop-down lists in the system for clinical elements or for vitals. So I'm going to click in here. There should be one called smoking. There's one called smoking habits is the one that you want to edit, not smoking attributes. There's 2 in there. Smoking attributes is tied to how many packs they smoke a day. Or not, yeah, per day. In here I have current smoker, former smoker, never a smoker. This is just tied to the drop-down. It's not tied to any information that you have passed in the system. So if you change this, it's not going to corrupt anything. That's what I'm trying to tell you. So all you have to do for here is if you edit the ones that are in here, you can just change that name to whatever you want to. And then for the 2 other ones, you would just hit new, and then you would add those 2 other items to the drop-down list. You do have to match those exactly how they are right here. And one of the things that a doctor recommended from the last session was the way that he is going to be using this is he's going to use conditional logic. So I don't know if you guys are familiar with conditional logic, but basically what it's going to say in the template is if patient smoking status equals nothing, so they don't have anything in their smoking status, it's going to insert those 5 quick texts where they can actually pick and choose which one of those options they can do, and then it's going to have a dot code that'll push to the vital system. So that's going to be an easier workflow for that practice to use. So that's something that you guys can do as well if you have that conditional logic and you're comfortable with that. So here's the measurement is more than 50% of all unique patients 13 years or older have a smoking status as structured data. Here's the denominator, so it's basically all of your patients that are 13 years or older in between that from and to date. And then the numerator is going to be the number of patients in the unique patient set where patient age is 13 years or greater, and they're specified whom is the smoking status is entered.